Chapter 10, Muscles. So the muscular system, of course, you have about 700, you have approximately 700 muscles, of course, in the body. When referring to the mechanics of the muscle movement, tendons, of course, are going to attach muscles, of course, to bones. So you have what we call an origin, insertion, and an action of every muscle. So the origin is the part of the muscle that is attached to a more fixed part of the skeleton. So it's where it originates. So usually this one, of course, sorry about that. So the origin usually is, of course, usually the proximal end, whereas the insertion is usually going to be on the distal end of the bone. Okay, so and not in all cases, but in most. So the insertion is going to be the muscle is going to be attached to the more movable part of the skeleton. Actions, of course, are the main movements, of course, that are going to occur when the muscles are going to contract. Okay, here is an example to show you about the origins and the insertions. Okay, so the origin here, of course, this is showing you the biceps brachii muscle. The origin for this muscle, and it has two heads, so it comes up here and it attaches, of course, to the scapula. So the origin is the scapula. And of course, that's going to be, remember the origin, of course, is going to be the proximal. So this is on the proximal end. It also is on the part that is the least movable, or the more fixed part of the skeleton. And then the other part, the distal part of the biceps brachii, comes down here and attaches to, of course, the radius bone. Okay, so that's going to be the more movable part. So that's what they refer to as the insertion of the muscle. Okay. Um, and again, of course, this movement here, of course, is producing a flexion movement. So down here asks you which movement is producing a flexion of the forearm. It would be the action. Motion, of course, occurs when the effort is going to be applied to the bone at the insertion if it exceeds, of course, the load. So we talk about levers and body mechanics. Musculoskeletal system as a lever system. So the lever is a rigid structure that can move around a fixed point. So we have the effort, which is going to be the force or the applied force due to the muscle movement or causes the movement. The load, of course, is going to be the resistance. It opposes the movement. So the load is usually going to be like some type of weight. So this will be the weight that is being moved, such like if you a weight of a book to be overcome before you can pick it up. Okay. Fulcrum, this is going to be a fixed point, and this is referred to as the joint. And of course, the force is going to be the applied by the muscle. So, of course, in the human body, of course, each bone is going to have a type of lever system or class, and each joint is going to be the fulcrum, and of course, muscles crossing the joint provide, of course, the applied force. And here's just showing you an example of a lever system, and I just showed this one first before the next slide because I just wanted to know the abbreviations on these next few pictures. So the L is going to stand, of course, for the load. The F is going to stand for, of course, the fulcrum, and it tells you here, and the AF stands for the applied force. So they give you an example here of using a pry bar to move a log. And that's the first example, of course, in our first class. So there's three classes of levers. So the first class, of course, is a fulcrum. Of course, is between the applied force and the load. So it acts like a pry bar. So the distance moved is actually going to depend on the relative sizes of the force and the load, and on how far is it from, of course, the fulcrum. The human body example down here is the head and the neck. So if you look at this, the fulcrum here, of course, is going to be that joint between the atlas and the occipital bone. Your load, of course, is going to be the weight of the anterior portion of the skull or the head. Applied force, of course, that's going to be the muscle that is contracting to raise the head up. Okay, so the fulcrum again is always usually a joint. The applied force or the effort is going to be some type of muscle lifting it up, and the load, of course, is going to be the weight. So a second class, this one, of course, is uncommon in the human body. There is one example here. Of course, that's the plantar flexion at the ankle joint. But the second class is uncommon in the human body, but it produces the most force or the most weight bearing. So if you look here, the gastrocnemius muscle is lifting up a person to stand on their toes. So they're lifting the whole body's weight. So it sacrifices speed and range of motion to lift. So just showing you the example of sitting on the toes. Again, the fulcrum, of course, is going to be the foot, that joint, okay, on the area here with the toes. The load, of course, is going to be the weight of the body. And of course, you have the applied force, which is going to be the contraction of the calf muscles, raises the heel off of the ground. Third class, of course, that this one is going to be the most common, of course, in the human body. The speed and distance traveled are going to be increased at the expense of the effective force with this class. An example here, of course, you have the biceps brachia. The load is going to be 6 times farther from the fulcrum than is the applied force, so the effective force is reduced to the same degree. So again, example again, you have the fulcrum here is going to be your elbow joint. The applied force is going to be the biceps brachii muscle. And of course, the load here would be the weight of the hand and forearm and anything that it lifts. So checkpoint questions. Muscles and bones, of course, are working together as lever systems. And of course, of the 3 class levers, which represents the action of most muscles. And that would be your third class because that does the flexion motion. Skeletal muscle fibers or cells within the muscles are going to be arranged in bundles known as fascicles. So your fascicles are going to form patterns with respect to the tendons. So we have 4 main ones. Now some books will separate this one out into 2, parallel and fusiform, but this book puts them together. So parallel and fusiform, circular, convergent, also known as triangular, and pinnate. So a muscle coarse fiber can contract, or when it contracts, it shortens to about 70% of its resting length. First example here, we have the parallel muscles. This one, of course, has a great range of motion, and I'll abbreviate range of motion, ROM. And this is showing you this one is right here. An example, of course, is going to be the biceps brachii muscle. Another muscle would be an example of the parallel would be your digastricus muscle. But the fascicles are nearly parallel in longitudinal axis of the muscle. So they're going to be long. They terminate into tendons. Okay. Now I want to terminate into tendons. So you see you have a tendon on each side of this. So the middle part is going to be what they call the belly. This is the belly of the muscle. So it has a belly and it tapers at each end. So as the belly goes down, it gets smaller. So that means it tapers. So some things to know about this one is I know that the parallel muscles shapes, of course, is also known as the fusiform. They're long, terminate into tendons. They taper at the ends, and they have a belly. This one, of course, is also known as your triangular muscle because it gives a triangular shape. It's the convergent muscle. The things you need to know about this one is it's going to have a triangular shape, and it covers a broad area. And your example, of course, on this one is the pectoralis major muscle. So it covers a broad area, and it is triangular shape. Pinnate is broken down into subcategories. So you have unipinnate, you have bipinnate, and you have multipinnate. So all of these are going to be short. The tendon, of course, extends the entire length of the muscle. So those are the two of the main parts of all of them that you need to know. They usually tend to be short, and the tendon nearly extends the entire length of the muscle. Okay, on the unipennant, what that means is you're going to have muscles on one side of the tendon. See, muscles are just on one side. With the bipennant, you have the muscle just on this one side on the unipennant. Bipennant, you have muscle on both sides of the both sides. So you have muscle on this side, muscle on this side. Okay. Multipennant is going to be muscles are going to be attached from many different directions, and you can see that here. And we give you examples here. So the multi-pennant would be the deltoid muscle. An example of the bipennant would be the rectus femoris, and the unipennant, of course, would be the extensor longus muscle. And again, this is just showing you another picture of those three different ones, and it shows it to you, of course, on the body as well here. Next, we have the circular muscles. Circular muscles, of course, these are going to enclose. What you need to know about this one is they are circular. They form a sphincter muscle, and that sphincter muscle, of course, is going to enclose an orifice or an opening. Okay, so the example of this one that we've already talked about is the orbicularis oculi. It goes around the opening of the eye, and orbicularis oris, which goes around the opening of the mouth. And of course, they're showing you the example. In this thing, here's orbicularis oculi, but over here on the picture, they're showing you orbicularis oris, the one that goes around the mouth. So the effects of muscle fascicle arrangements, they have a compromise that they must make. So they must compromise between power and range of motion. So the longer the fibers in a muscle, the greater the range of motion it can produce. The power of a muscle depends not on the length, but on its total cross-sectional area. So it is common to attribute a specific action at a joint to a single muscle bundle, but remember that muscles do not work in isolation. So movements usually result from several skeletal muscles acting as a group. Most skeletal muscles are going to be arranged in opposing pairs. So you can have antagonistic pairs at the joints, or which, such as example, that would be flexors and extensors. So when complex movements occur, muscles are going to work in groups rather than individuals. So we'll talk about like the quadriceps groups. That's actually 4 different muscles. Your hamstrings are 3 different muscles. So we talk about those in groups. Their corporation, of course, what it does when they work together, it allows it to be improve the efficiency, of course, of a particular movement or action. So muscles work together. Many muscles usually work together in groups, like I told you. We have names for those: agonist, synergist, and antagonist. So these groups, most are going to be arranged in opposing pairs at the joints. We've already talked about that, like your flexor extensors, your abductors, adductors, or some examples. The agonists, of course, are going to be responsible for producing the given movement. So if you look here, you have an agonist mover, of course, as it's going to be the biceps brachii, what causes the flexion at the elbow. This is the agonist is going to be responsible for the actual given movement. Okay, synergists, what these do, they pretty much assist the prime movers. So the muscle that helps larger agonists work efficiently. So they may provide additional pull to stabilize that origin of where the muscle is attached. And they do that in order to prevent unwanted movements at other joints. So brachioradialis would be, of course, the synergist for the elbow flexion. So it shows it down here for you as well. Fixators or synergists that, of course, that assist by preventing movement, of course, at another joint. Antagonist, these, of course, are oppose a given movement, particularly the agonist. They're depending upon the movement required. Many muscles may act as prime movers, antagonists that are just our fixators. And of course, it shows you here the agonist for the elbow flexion, of course, is going to be your triceps brachii. So the agonist was the biceps brachii. The antagonist is going to be the triceps brachii. And the synergist, of course, was down here, of course, on of course the radial bone, of course, to help stabilize that elbow joint. So a couple of checkpoint questions. Again, when you get to the checkpoint questions, try to answer these on your own first, and then I'll go over the answers. So you could pause it if you wanted to. So intramuscular injection is going to be an injection into the muscle. It penetrates the skin and the subcutaneous tissue to enter the muscle. So they are preferred, intramuscular injections are going to be preferred method delivering medications, of course, when prompt absorption is needed of that medication into the body. So what are some common sites for intramuscular injections? That's going to be the gluteus medius, and that is the common name for that is your buttocks. Your deltoid, the common name for that is your shoulder. And the vastus lateralis muscles, that's going to be the outer thigh. Next, we have blank is to achieve normal range of motion of joints, that mobility of soft tissue surrounding the joints, and that's stretching. So what are the 4 benefits of stretching? So both of those blanks should say stretching. Stretching is going to improve physical performance, decrease the risk of injury, reduce the muscle soreness, improve the posture. Another thing, skeletal muscle groups in your muscles are named by different types of combinations. It could be location of the muscle, size of the muscle, shape of the muscle, direction of the fibers, number of heads. And what I mean by number of heads is like your biceps brachii. It attaches in 2 spots, so it has 2 heads. Action would be another one. So on the next 3 slides, or 4 slides, I'm not going to read through every one of these because you can obviously read these charts. But these are muscle terminologies. And what it is, these names can provide clues to the appearance and or function. So being familiar with the terms in these tables will help you to identify and remember specific muscles. On your quiz or your test, I may not do it on both, but on one or the other, I'm going to maybe do these as matching. So like if you have or multiple choice, I may say the medical terminology, abdominis means what? This would be abdomen. Some of these are pretty obvious ones like ocular, eye, iris, mouth, but some of them you have to just kind of memorize. Some of these are going to be a review from your Chapter 1 when we talked about the body terms. So make sure that you know these terms. It'll really will help you out a lot in this class. It'll also help you out extremely a lot in your medical field curriculum, which one you decide to take. So this one right here is showing you the terms that are going to be specific regions of the body. This set, again, this is going to be a lot of review from Chapter 1, like interior, front, external, on the outside, inferior, below. So these are going to be terms indicating the position, the direction of the vascular organization. These tell you the name of the organ. So bi meaning 2 heads, tri meaning 3 heads, quads meaning 4. Okay. These are going to be based on your shape. These are going to be based on like striking features, like if they're short, slender, wide, long. Okay. Large is magnus, larger is major, things like that. Minimus is small. So some of these are pretty obvious, but some of them you'll have to memorize. Here are some just general ones you have to know. Again, these is kind of a review from Chapter 9. Tensor, tensing movement, supinator, turning into supine position, pronator, turning to the prone position, flexor, extensor, things like that will be kind of a review from Chapter 9, or Chapter 8 and 9. Specifics, buccinator or buccinator. Okay, so these are some that you have to kind of just memorize. So this is into part 1. I will record, starting on part 2, I'm just going to go over some of the muscles that you need to know and the actions. And as I go through here, a few of them, I'll talk about the organ insertion and organ insertions with them. Because usually what I like to do on the test is I have you give me an example of 1 or 2 muscles, and you just have to, you pick which organ insertion you would like to tell me with your particular muscle that you choose.